We recognize the critical role of educators, religious leaders, community elders, elected representatives, civil society in this collective effort, community health promoters who are our foot soldiers on the ground. And we must all work together to protect our future generation from the devastating grip of drugs and substance use and mental health illness. I therefore call upon all stakeholders, public, private, faith-based development partners, citizens, to stand united in confronting this national health issue. And let us join hands to create a healthier, safer, and drug-free Kenya, where all citizens, and most importantly, our youth, are equipped with the knowledge and the support to make informed choices. Through the Social Health Insurance Fund, we have been able to cater for detoxification services, rehabilitation services. We also have mental health services that are there for outpatient and inpatient. So it is important that these measures are designed to remove the financial barriers and standardize treatment costs and encourage early intervention and recovery for those that are affected. So we encourage people across the country that they may register to the Social Health Authority so that the masses can enjoy and can access these services with ease and with affordability without draining our pockets. So while progress has been made, it is clear that continued, coordinated, and adequately resourced action is required. And moving forward through the State Department of Public Health, we wish to strengthen enforcement of existing drug control laws, expanding school-based and community-level awareness programs. We wish to also support youth empowerment and economic inclusion, and equally enhancing community leadership and stakeholder ownership and engagement. It is important to equally develop tailor-made county action plans and appointing drug and substance abuse focal persons in each of our counties, establishing the national knowledge hubs for training, research, and practice. That is why we are asking members of the public to avoid over-the-counter medication and prescribing drugs for themselves. It is important to note that antibiotics resistance is a reality as at now. We would seek and we will request that members of the public, should you get unwell, please visit a health facility where you will find a skilled healthcare workforce that will guide you and will prescribe to you the kind of drugs that you require for your body and your ailment. Antimicrobial resistance, the subject is real or is live, like it's a conversation globally. But antibiotics resistance is a reality because most people are getting minor ailments and they rush to the chemist, they prescribe themselves, they buy antibiotics, and then when it exists in your body for a long time, it does not work anymore. The day you will require it, it will not work. Therefore, it is important for people to stop abusing drugs. When you have a common cold or a flu, don't rush to buy antibiotics. Go to the doctor, ask for a proper prescription, and get the right drugs that have been prescribed by somebody who is skilled and with the knowledge of knowing what your body requires. It's of great concern when you see the young people, and especially the ages between 15 and 35 years. They are the ones who are involved in drugs and substance use. Especially now when we know the youths, some of the youths who are in higher institutions, tertiary institution, they will be on long holiday. it is important to ask you that do not use drugs and substance. The current trends and the national data that is collected in 2022 underscores the gravity of the crisis among the young people aged 15 and 24 years, and that 1 in 11, approximately 632,000 individuals, is currently using at least one drug or a substance. And in the 25 to 35 age group, over 1.5 million individuals are reported to be affected. The ranking of commonly abused substances include alcohol. We have cat at number 2, which is Miraa, commonly known as Miraa. We have tobacco, we have cannabis, we have the prescription drugs. And the rising trend is fueled by a combination of factors, including peer pressure, unemployment, limited access to education, and counseling services, and the widespread availability of illicit substances in informal markets. The most prevalently abused substances include alcohol, especially the illicit brews and counterfeit spirits, bhang, Miraa, tobacco, prescription medication such as codeine, and sedatives. And in some urban areas, we have had drugs such as heroin, cocaine, and of growing concern, the increasing availability and use of the novel nicotine products and emerging tobacco variants, which are aggressively marketed to the young people, posing new regulatory and enforcement challenges. Currently, the trends that we have, and especially the national data that dates back to 2022, underscores the gravity of this crisis among the young people between 15 and 24 years. The Ministry of Health, through the State Department for Public Health and Professional Standards, we wish to express deep concern over the escalating public health threats posed by drugs and substance abuse across the country. And this menace has devastating consequences, particularly among the youth aged 15 and 35 years.